On your day of surgery, you will have been previously given a time to come on into St. Joseph Hospital. You will come to the same area where you're taken for pre-admission testing when you had that appointment. It's the area right above the gift shop on the second floor near our water wall. There is a lobby there. You can have somebody with you for your preoperative period of time. This blue express pass you were given, please bring that with you to the hospital on your day of surgery. It will be labeled with your name and date of birth and medical record number. And you can take this pass. There's a little basket at the reception desk in that area, and just take a seat, and when it's your turn, they'll know you're here and they'll take you back to get you ready for surgery. A few things to expect that morning. You're going to have at least one IV started by your preoperative nurse. You'll be changed out of your clothes and into a hospital gown. They will be getting your vital signs several times. You will also be measured for sequential compression devices, something we call scuds. They are air sleeves we put on your lower legs that will massage your legs and help circulate your blood flow back up towards your heart. This helps prevent blood clots. You will also probably be visited by the nurse practitioner who works in the preoperative area. She will again ask you your name, your date of birth, why you're here, any allergies you may have, and may go over your medical history again. If you did not get to see the anesthesiologist at pre-admission testing, this would be the time that person comes to see you as well. As well as there is a medical team that our neurosurgeons like to use just as backup if we need anything from a medical standpoint. And depending upon the time of the day, they may come and see you in the preoperative area as well. There is a television in the preoperative area, and as I said, you can have a visitor stay with you in that area until the time for your surgery comes. If you get cold, just let them know. They'll get you some extra blankets. And this is where you stay until it's time for your surgery. At that point in time, the circulating nurse and maybe another will come to collect you for the OR. This is when they're going to do something which is called a timeout or a hard stop. And once again, you're going to be asked who you are, what your date of birth is, what you're having done, who your surgeon is, and that is very important. And even though you've been asked that probably 20 times already that day, we want to be sure you are you and we are taking you back for the correct surgery with the correct surgeon. At this point in time, your circulating nurse is going to take you back towards the OR, and that is when you're going to part from your family member or friend that comes with you that morning. And you can expect to be apart anywhere from about 3 to 4 hours at this point in time. When you get to the OR, you will find that it is very cold. Again, if you are cold, please let them know. They will get you some more warm blankets so you're comfortable until you're under anesthesia. Before your anesthesiologist puts you to sleep, you are going to be assisted to move to the surgical table. They will get you comfortable there, and then the anesthesiologist will do their job. Their job also is to monitor you constantly through your surgery, your heart rate, your heart rhythm, your oxygenation, and all those sorts of things. So the anesthesiologist will be focused on you while your surgeon is working on your spine. Something I like to point out at this point in time is it's very important that you are positioned correctly for your surgery, of course, and that you are stable on that operating table. There are a lot of pads and belts and straps that are used to keep you still, stable, and in the correct position. Of course, we all want to make sure that happens, but it is not unusual after a person wakes up from surgery to say, well, what is this across my arm, or I feel this across my legs? I will also have patients sometimes complain of feeling a little pressure on their forehead or their chin because you are somewhat face down during surgery. Also across the chest or maybe across the pelvic area. And this is all because of positioning from your surgery and the belts and straps and pads that they use to keep you safe and stable while they do the operation. In general, most of these spinal surgeries last for about 2 hours. If there's not quite as much work for your surgeon to do, it could be closer to an hour. If it's a much more complex case, it could be closer to 3. But as a general rule, we like to say this is about a 2-hour procedure, and we like you to pass that along to your loved ones so they can get a good time frame of how long they're going to be away from you. A couple of things I do want to point out that you're going to be hooked up to. You will have a finger sensor called a pulse oximeter, and that is going to help us keep track of your oxygen levels in your blood, which is very important. I already mentioned the SCUDs, or the sequential compression devices. You will have a blood pressure cuff as your buddy throughout the surgery and recovery room, at least one IV. And likely you will wear oxygen for a little while, obviously during surgery, during the recovery phase, and postoperatively on the 6th floor. Two other things that you may or may not wake up with after surgery is, number one, a Foley catheter. That is a catheter that goes in your bladder to drain urine. Typically, we like to stay away from catheters because of the risk for bladder infection. However, if your surgeon works on your spine in an area where the nerves innervate your bladder, they may place a Foley catheter that you'll keep overnight and somewhat into that next day just to let those nerves calm down. Without a catheter, you may experience some urinary retention and have to have a catheter anyway. So in that sterile environment of the OR, they will go ahead and put a catheter in if it's necessary. Another thing you may wake up with is a surgical drain, typically a Jackson Pratt drain, or you may hear us called a JP drain. And again, your surgeon very often doesn't know if they're going to place a drain postoperatively or not until they actually do your surgery and see how things are going. If they do not place a drain, it is not unusual for us to have to change your dressing many times over in the hospital. Any drainage left inside of you is going to find its way out. Sometimes that can be alarming if that's not something you're used to seeing. But the staff on the 6th floor are very, very used to that, and we will coach you through that if you do have a lot of drainage. If you do have a postoperative drain put in, usually that stays in for about a day and a half, and the nurses are going to remove that before you go home.